Well, I'm a full-time working mum. I've got 4 kids. I work in the University of London and I work in the business development. I've always not liked my side profile. I started to notice my face dropping a little bit, especially my lower half of my face. I feel like my under eyes need a bit of help. So yeah, just an overall refresh of the face.
Fantastic. Hopefully we can help you out with that. I always think it's nice knowing the motivation behind why people do cosmetic treatments. A lot of people kind of pin these cosmetic treatments as vanity. They say it's vanity treatments, whereas kind of doing this for nearly 7 years now, I realized that there's a lot of people that are in a similar situation to you where it's not really vanity.
No.
You know, people notice changes in the face as they get a little bit older, busy lifestyles, having children. It can change the way, maybe not dramatically, but in subtle ways, it can change the way that you look. And that in turn plays into the way that we feel about ourselves as well. So not only do we kind of help improve the way someone looks, the real goal is kind of to make someone feel better about themselves as well. And that's really the goal of today.
Part of the reason why I wanted to come to you is because I don't want to change my face. I just wanted to improve on these certain areas and without having to have like drastic changes.
Understood. Annie, what we'll do, we'll go over to the treatment room and we'll have a detailed conversation about these concerns and anything else that might help. Today we have Annie with us. She is a 34-year-old female who has never had any cosmetic procedures done before. We are going to be carrying out a full face dermal filler treatment. So Annie, we've had a brief conversation about some of the concerns. Just to summarize, your 2 main concerns are under eyes, side profile, primarily the chin area. Is that all right? So I'll talk a little bit about these areas, but then we'll talk about any other areas that we can potentially treat just to improve the overall look.
Yeah.
So the under eye area, what I can see, there's a hollow in the area, there's good skin quality, there's a little bit of pigmentation, but if there's a hollow and there's pigmentation, you almost always get the best result with tear trough filler first. By improving the hollow, it gives you a smoother transition from the under eye to the cheek. Now, you said you're 34 and there are some predictable changes that happen once we start dipping into our 30s. The primary thing that we see is volume loss and change of volume in certain areas. So I'll just talk a little bit about some of those changes and relate them to you. So working from top to bottom, there's a little bit of volume loss in the temples. The reason why that's an important area to treat is because we want a smoother transition from the forehead to the cheek. It's not bad, but there's a little bit of a hollow in the area. There's some volume loss in the under eye area and volume loss in the apples of the cheek. Your cheekbones are actually really nice. You've got sharp cheekbones, and to be quite frank, they're going to stay with you for the rest of your life. But the area that does tend to lose a little bit of volume is the apples of the cheek. As we get older, this area starts to sink down. So then we get deepening of the nasolabial fold. This area here, unfortunately, is called the jowl. As we get older, it starts to sink down and it interrupts the jawline. Ideal jawline is a smooth transition from the angle to the tip of the chin. Looking at the side profile, I don't think you've got a bad side profile, but if I was to improve it, I would project the chin from the side. That will balance the side profile, lifting the tip of the nose and softening any little bumps that I can see in the bridge of the nose. You talked a little bit about your lips. I think you've got a very pretty pair of lips. The goal is to hydrate, improve the volume slightly, but make sure that they're within the realm of natural. So that's what I would do as a treatment plan. Is there anything that you disagree with there?
No, I completely trust you and
Okay, cool, amazing. Regarding the procedure itself, all we're going to be using today is dermal filler. Dermal filler is a gel. The gel is made of hyaluronic acid. We naturally have hyaluronic acid in our body, so it's not seen as a foreign substance. It's been stabilized, so it has a gel-like quality and it has longevity. When we inject it, you see results almost immediately. There will be a little bit of redness and swelling today. Sometimes you get a little bruise in the areas, but today it will still look nice, but it will look its best at 2 weeks. At the 2-week mark, that's the finished result, and that result will last anywhere between 1 to 2 years.
Okay.
Any questions, any concerns?
No, none. Looking forward to it.
Cool, amazing. The areas that we're going to be addressing is the temple area. We're going to work down. We're going to do the mid-cheek, then the under eye area, then the nose to mouth lines. After that, we'll address the pre-jowl and chin for structure, and then we'll fill in the gaps in the lower half. You can see some shadowing, and we're just going to address all of those areas. Cool, we're going to start off with the temples now, and you're going to feel a little bit of a pinch. If you just keep your mouth a little bit open and just don't bite down, it'll just make it more comfortable for you. You'll feel a scratch and then a slight pressure sensation. I'm watching the area grow as we're injecting. It was coming out. I'm just going to do a similar injection just next to it. So big stretch, needles going in, sharp scratch. Well done. And our entry point is going to be there. Just going to pinch the skin and you're going to feel a small little entry point. Nothing dramatic though. So sharp scratch. Needles coming out nice and slowly.
What was that done?
That's the needle entry point.
Oh.
And then now I'm going to go under the skin with a cannula. Yeah. So worst part done though. That's probably the worst part, yeah. This part just feels weird, so I'll talk you through it. So we're just going to go under the skin initially. You're going to feel a pinch, gliding under the skin initially. And then now I'm going to go under the muscle. You're going to feel a pinch and then comfortable again. Okay, so pinch. So that's the inner aspect of the tear trough done. There's now a smooth transition from the under eye to the cheek area. We'll do the outer aspect after I've done the other side, okay? But you can have a quick look. You can see the differences between one side and the other.
Wow.
So you can see smooth transition, and there it still catches a hollow.
Yeah, that's really good.
Cool, it's nice, isn't it? Yeah. So we've just completed the tear trough treatment using a cannula on the inner aspect of the eye. This is where most people will stop and they'll say this is the end of the treatment. However, the tear trough area has an inner part and an outer part. The inner part is best addressed with a cannula. The outer part is best addressed with a very fine needle against bone. Perfect. Cool. You can even have a look from one side to the other.
Oh, wow.
You can see smooth transition.
That is so good. It's so subtle, but
noticeable, right? So Annie, we're probably about halfway through at the moment. We've done temples, under eyes and cheeks. How are you feeling so far?
So far, so good. It's not hurt one bit.
Amazing.
And I'm seeing subtle changes as I'm going along, so it looks really good.
Good. Amazing. Kind of what you expected?
A bit better.
Cool. Good.
Better than what I expected.
Cool. Amazing. So now we're just going to address the middle and the lower half, and then, we'll have a look together, okay? It's going to be a little bit of a pressure sensation, not over the top painful, but a little bit of a pinch, okay? 3, 2, 1, sharp scratch. Well done. And you're just going to feel a bit of a pressure sensation as I'm depositing product in the chin. Nice slow injection for comfort. Going to measure out the side profile. We can probably push the chin out ever so slightly more, tiniest bit more in the chin, and then I'm going to address the pre-jowl area, okay? So same again, drop your bottom lip, needles going in. Looks good. Cool. Head a little bit this way, now it's going to be along here, okay? A little bit pinchy, not awful. Do you see the benefit of that? So this is the treated side, smoother transition from the angle of the jaw to the chin. You can't really detect the jowl on this side, and on this side, this area still looks quite heavy. So it's heavy, and then there's a dip in front.
It's the jowls what makes this bit look.
Exactly.
Yeah.
So this entire area is the jowl. There's an inferior part and there's a superior part. It sinks down and it folds over. So that's why we get this line over here. So the best way to treat it is in front of the jowl here in the lower part, and then in front of the superior part of the jowl in this area. I'm not looking to place a lot on your lips, maybe half a mil.
Yeah, okay.
Yeah, I mean, look how good the lips look even right now.
I was just about to say, the lips look actually better.
Because we've done everything else.
Yeah.
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 This pinches a little bit, not
We do
awful.
lips now?
Not straight away, just that crease, yeah. So, yeah, keep your mouth just like that. Sharp scratch. Sharp scratch. Cool, and then we're just going to do your lips, and then we should be kind of home stretch, really. Perfect. A little bit pinchy, but not awful. Everything is going to be really numb. So, big stretch. Sharp scratch. Perfect. You can have a look.
Oh, wow.
Yeah, minimal swelling, minimal redness.
Yeah, that's perfect. You don't need
Yeah,
it.
no, I'm happy with that. Yeah, they'll go down a tiny bit from what you can see.
Yeah.
But, I mean, they look good to me.
Yeah.
Again, I already said you had a nice pair of lips to start off with. Getting there.
Looks really good, though.
Looks nice, eh?
Yeah.
How much have we done? 1, 2, 3, 4, 5, 6, 7. 6, 7 mils.
God, that's all I hear. 6 ever. I've got 3-year-olds saying 6 ever. I still don't know what it means, but there you go.
I think that's the thing. It doesn't actually mean anything. That's the whole joke, right?
Yeah.
So now we're going to work on the nose. There's 3 main things that we're going to be doing. The first injection is the base of the nose. This is an invisible injection. You don't actually see anything, but what it does is it supports the base of the cartilage and increases the angle of the nose. Next, tip of the nose, a little bit pinchy but quick. That just elevates the position of the tip, and then a little bit above the bump if we need to do it there. End result will be a straighter nose, but you know, even if it's not pinned straight, it's okay. We'll just get it as straight as possible. There we go. Bit of a pressure sensation. Perfect. And we're there. Needles coming out. Well done. Bit of a massage. Perfect. Reasonable?
That was the corners of the mouth.
Really?
Yeah.
Okay, cool. That one's usually a rough one, so you did well. Cool. Next one's the tip of the nose. A bit pinchy, not awful, but a bit pinchy. Needle's about to go in. Sharp scratch. Well done. That looks great. A little bit above the bump, and then if I need to do more on the tip, I can do more on the tip, but let's do the bump first. Sharp scratch. Almost done. I'm using raindrops, okay? Tiny amounts. Sharp scratch. Wait there, don't look. I'm gonna just clean. Photo from the side just to show you what a side profile looks like. Just to show you that it doesn't look overly, but that's what the nose is looking like.
Oh, wow.
So pin straight, lifted but not overly lifted.
Yeah.
It doesn't look weird or anything. But the real reason is that side profile.
Yeah,
is
it's good.
essentially almost perfect.
Perfect.
So you can have a look in the mirror now as well if you want. You can have a look from a few different
wow.
angles.
Yeah, so it doesn't look too...
No, it still looks like a normal nose, but the bump is gone now.
Oh, wow. That looked amazing.
Looks good.
So good. I love everything.
Cool, yeah, it looks good.
Yeah.
Everything looks nice.
Just looks refreshed.
Yeah. So now we're essentially done.
Yeah.
Like we don't have to do anything else. But what I do now is I just have a look at everything and just see if there's any room for improvement. There's 1 or 2 areas that I feel like I can tweak, just to get things looking as good as possible. What are your thoughts about it? Is there anything you would change, tweak?
I feel like this cheek looks slightly...
I agree. I agree. So that was one of the areas that I want to treat. Mainly in the apple of the cheek.
Yeah.
This apple looks nice and smooth.
Yeah.
This I can still see a little bit of volume loss. Just a gentle massage in some of those areas. Anything you'd change?
No.
Cool, looks good.
Looks really good. And it still looks very natural.
Super natural, right? If you were to meet someone now, they would not know you've had filler done immediately afterwards, right? So, you know, in 2 weeks, it's going to look even better once everything is settled.
I can't wait to do my makeup.
Yeah.
Can I just look that much nicer? I would describe my experience as a really positive one. I feel like I've achieved what I came in for. I think you addressed all my concerns. I think you did a better job than I thought that I would be getting. I really like my lips and my nose. I like how natural it looks. I think it looks great. What surprised me the most is having filler in places that I didn't think that I needed it. And also how painless it was. It was very well done. You told us what we really need. You didn't just say that yes to whatever I wanted. You addressed all the concerns and made it look as natural as possible.
So that was Annie's treatment journey. It was her first time having any sort of cosmetic treatments, but you can see how comfortable she was during the process. You can see the results and you can see how happy she is with the results that we've managed to achieve. And this is what we do here at Mindful Aesthetics. We don't just treat faces, we treat people. We understand their main concerns, we listen to their stories, and we design bespoke treatment plans to give them the absolute best results. If you want to see more treatment journeys like this, like, comment, subscribe, and I'll see you in the next one.